The itch you should never ignore. A warning from Dr. Rafael Martinez, an 88-year-old oncologist. I don't usually mention this symptom at the hospital because this kind of itch may be much more than just a skin issue. After over 50 years of caring for patients, he has come to a vital conclusion. A persistent itch can be an early warning sign of cancer. Listen closely, friends. Have you noticed a particular area of your body feeling unusually itchy lately? Have you tried moisturizers, ointments, creams, and nothing seems to work? Many people think, oh, it's just age-related. But don't fall into that trap. I still see patients every Tuesday and Thursday in my clinic. An 88-year-old doctor, still active. Surprising, isn't it? One of the reasons I'm able to stay so active and healthy is that I don't ignore subtle warning signs. And today, I want to share something truly important with you, the potentially frightening truth behind a persistent itch. Last winter, a 75-year-old man, Don Antonio, came to see me complaining about an itch on the lower part of his legs. He said the itching would only happen after showering. Every day around 3 a.m., it would wake him up. Lotions and creams did nothing. At first, I thought it might be simple senile pruritus, or perhaps eczema. But something about what Don Antonio said kept nagging at me. Doctor, there's nothing wrong with the skin itself, so why does it itch so much? It felt different than a typical skin problem. I advised him to undergo further testing. The results were shocking. Early-stage lymphoma. I'll never forget what he told me afterward. I thought it was just because I was getting old. That's when I realized how many signs like this had I overlooked over the years. Since then, I've encountered similar cases. A 68-year-old man with a persistent itch between his shoulder blades, pancreatic cancer. A 73-year-old man with an irritated scalp, pre-leukemia. From that day forward, I've never taken an itch lightly again. That night, I reviewed my 50 years of patient records and discovered a startling statistic. Roughly 1/3 of my cancer patients had experienced localized itching in the 6 months prior to diagnosis. This was no coincidence. I began researching, reading medical journals, speaking with colleagues, and identifying patterns. Eventually, I discovered 6 specific areas of the body where itching can signal the presence of cancer. If you're over 60, it's especially important to stay with me until the end, so you can fully understand what I'm about to share. The information you're about to hear could save your life. There are 2 things I'll be telling you today. The 6 dangerous areas where cancer-related itching can appear. Simple self-diagnosis, tests you can do at home. If your body has been feeling irritated lately, please listen through to the end. 1. The lower legs. Let's begin with the lower legs, especially the front part of the shins. If you feel constant itching in this area, it's crucial to get tested to rule out lymphoma. When the lymphatic system becomes inflamed, inflammatory substances stimulate the peripheral nerves. That's when itching appears, an itch that's very different from a typical skin irritation. Let me tell you again about Don Antonio, the 75-year-old man I met last winter. For 3 months he suffered from itching in his legs. At first, it was just occasional, but then it became serious. At 3 a.m. every morning, the front of his legs would itch so badly that he couldn't sleep. Scratching didn't relieve the sensation. In fact, it made it worse. He found it very strange. At first, he thought it was due to poor blood circulation, so he tried warm compresses and massages. He even wore compression socks. His wife, concerned, bought expensive lotions for him, but nothing helped. There's a simple way you can check this at home. Apply moisturizing lotion or anti-itch creams 2 to 3 times a day for 1 week. If it's a common skin issue, this should help. However, itching caused by lymphoma does not improve with these treatments. In fact, it often gets worse. Another important signal is when the itching occurs. In the early stages of lymphoma, itching typically gets worse at night. During the day, everything seems fine, but once you lie down, the itching intensifies. This happens because the lymphatic system becomes more active at night. When you lie down, lymphatic circulation slows and inflammatory processes become more pronounced. It's important to know that itching related to lymphoma does not respond to creams or antihistamines. That's because the problem lies deep within the immune system, not on the skin itself. If your legs have been itching for more than 3 weeks and creams haven't helped, you need to see a hematologist or oncologist for further testing. Thankfully, Don Antonio's condition was discovered in time. He received treatment and is now completely healthy again. When lymphoma is detected early, the treatment success rate is over 90%. Have you recently experienced strange itching sensations on the lower part of your legs? 2. The middle of the back. Next, let's talk about the middle of the back. The pancreas is connected to the nerves in the back. When there's a problem with the pancreas, it often sends warning signals through the back. In the early stages of pancreatic cancer, bile can begin to flow backward, irritating the connected nerves. This results in persistent itching in the middle of the back. This is known as referred pain, when the problem exists in one area, but symptoms appear somewhere else. Not long ago, a 68-year-old woman named Doña Carmen came to my clinic. She had tried everything. She constantly felt an itch at one specific spot in the middle of her back. At first, she thought it was due to her bedding, so she replaced her mattress. But the itch persisted, so she changed her pillows, her blankets, and even deep cleaned her entire house, eliminating dust mites. She told me, "Doctor, we've flipped the entire house upside down. We threw out the rugs, even replaced the sofas, but I still have that same itchy spot." I gave her an allergy test and prescribed several topical creams, but none of it worked. Doña Carmen's itching had a specific pattern. It was fine during the day, but began every night after dinner. At first, she thought maybe she'd eaten something wrong, but no matter what she ate, the itching always started around the same time. Here's how you can test yourself at home. Gently press your finger against the itchy spot in the middle of your back. If the itch is related to the pancreas, you may feel a heaviness or slight discomfort there. You'll notice that it feels different from a typical surface itch. Also, pay close attention to your digestive health. The pancreas is a vital organ that produces digestive enzymes. If your back itch is accompanied by poor digestion, especially after eating fatty foods, you should be concerned. The key takeaway here is that pancreatic issues often manifest through back symptoms. Many people dismiss this as muscular pain or a strained back. They apply pain patches or get massages, which might bring temporary relief, but the itch always returns. If your skin appears normal, but a particular spot on your back keeps itching, don't ignore it. You need to get it checked. Have you experienced any strange itching sensations in your back recently? 3. The scalp. Next, let's talk about the scalp. Scalp itching is often a sign of leukemia. The symptoms are unique. When white blood cells are overproduced, inflammatory substances begin to stimulate the tiny nerves in the scalp. This is what causes the itch. This is especially common behind the ears and around the neck. One patient in particular comes to mind, Don Javier, 73 years old and incredibly meticulous. He kept a journal for 3 months, recording exactly when and where the itching occurred and how it changed. At first, he thought it was the shampoo, so he switched to one with gentler ingredients. Then he stopped using conditioner altogether. He even tried washing his hair every other day, but nothing helped. Strangely, there was no dandruff, no redness, yet he constantly felt the urge to scratch. It was worse behind his ears. What was even more curious? He felt fine during the day, but the itching intensified at night once he lay down. This happens because blood circulation patterns change at night and inflammatory substances begin to spread more actively. Here's how you can check yourself at home. Gently examine your scalp. If the itch is linked to leukemia, the specific area may feel slightly warmer than the rest of your head. This warmth is due to microscopic inflammatory responses. Also, pay attention to the itch pattern. Leukemia-related scalp itching tends to worsen at night, just like Don Javier's did. In addition, watch for other warning signs that often accompany the itch. Persistent fatigue, small cuts that heal slowly, frequent bruising, bleeding gums. If you've recently felt an unusual itch on your scalp or around your neck, and any of these symptoms also apply to you, you should request a blood test and a professional evaluation. 4. Around the chest. Next, let's talk about the chest area. Itching here may be linked to inflammatory breast cancer or even male breast cancer. When the lymph nodes become blocked, cancer cells can stimulate the skin, causing it to appear like the surface of an orange, accompanied by persistent itching. Unlike other types of breast cancer, there may not be a noticeable lump, so extra caution is necessary. I want to tell you about a patient named Doña Isabel who came in for a routine checkup a few months ago. She was 69 years old and paid close attention to detail. She said, "Doctor, the spot where my bra touches keeps itching, so I thought the bra was the problem." She tried cotton, silk, even bamboo fabric. She even stopped wearing a bra entirely and switched to loose-fitting clothes. But the itching persisted. What was strange was that it was only on her right breast, nothing at all on the left. Here's how you can check yourself at home. Stand in front of a mirror and carefully examine both breasts. If the texture of one breast looks different, if there's a bit of swelling, or if there's any color difference, be careful. Doña Isabel also had mild redness in her right breast. The itch began around the nipple and the underside of the breast, a common place where inflammatory breast cancer starts. Over time, the skin may become thicker and take on that orange peel appearance. When pressed, the skin loses its elasticity. This also applies to men. Male breast cancer makes up about 1% of all breast cancer cases. It's rare, but it exists. If you're a man over 60 and experience itching around the nipples, you need to get checked. It's important to know that even if there's no visible lump, if the skin is changing or there's persistent itching, it's time to take it seriously. Inflammatory breast cancer spreads more quickly than other forms, but it's still treatable if discovered early. Is anyone here experiencing persistent itching around the chest area? 5. Around the anus or reproductive organs. Now let's discuss the anus and reproductive area. Persistent itching in this region can indicate anal cancer or vulvar cancer. As the tumor grows, it compresses surrounding tissues. This stimulates the nerves and causes tingling and itching sensations. This is very different from typical inflammation or hemorrhoids. Let me tell you about Don Ricardo, a 76-year-old man who had suffered from hemorrhoids for the past 30 years. When he began to feel itching around the anus, he assumed it was just another flare-up. "Doctor, I've had hemorrhoids since I was young. I know what they feel like, but this time it's different." Normally, hemorrhoids hurt when sitting or during bowel movements, but this time it itched even while doing nothing at all. He applied more hemorrhoid cream and started doing sitz baths 3 times a day. He even went back to the hospital where he had his hemorrhoid surgery, but all he was told was, "Everything looks normal." Here's how you can check yourself at home. Pay close attention to the location of the itch. Normal inflammation or hemorrhoids usually cause broader discomfort, but cancer-related itching tends to be concentrated in one specific spot. Many people describe it as feeling like being poked with needles. The severity and pattern of the itching also differ. With regular inflammation, the itch tends to improve over time, but cancer-related itching worsens, especially at night. Don Ricardo said the itching got so bad at night that he could barely sleep. Also, look out for additional symptoms: bleeding during bowel movements, changes in stool consistency, Discomfort during urination? Changes in the color or smell of any discharge? And most importantly, observe how the itch responds to treatment. If it's a normal inflammation, sitz baths or creams will help. But with cancer, the treatments don't work at all. In fact, it only gets worse. It's essential not to delay a checkup out of embarrassment. Early diagnosis is critical in these cases. Like Don Ricardo, many people dismiss symptoms because they assume it's just an old problem returning. Is anyone here experiencing ongoing discomfort in this area? 6. The hands and feet. Lastly, let's talk about the hands and feet. If only the palms of your hands and the soles of your feet are itching, you should be checked to rule out internal cancers. Toxins produced by cancer cells travel through the bloodstream and irritate peripheral nerves, causing the tips of your fingers and toes to begin itching. This only happens when cancer has reached a certain stage, so it must be taken seriously. One case that stands out is Don Alberto, a 70-year-old man. He experienced itching exclusively in the palms of his hands. At first, he thought it was housewife's eczema and went to a dermatologist for treatment. He told me, "Doctor, I wear gloves when washing dishes. I even switched to gentle soap. Why is this happening?" He was very thorough. He applied lotion 5 to 6 times a day, wore cotton gloves while sleeping, and reduced hand washing to just once or twice daily, always using lukewarm water. Strangely, the backs of his hands were perfectly fine. Only his palms itched. In fact, the lines in his palms were especially irritating. Here's how you can test yourself at home. Take a close look at the soles of your feet and the palms of your hands. With cancer-related itching, the skin often appears slightly yellow, and the creases in your hands and feet may look deeper than before. In Don Alberto's case, his palms had a mild yellowish tint. The itching followed a very specific pattern. Both hands and feet itched, especially at night, though it felt better during the day. Also, the way the itch responds to treatment is very telling. With ordinary skin issues, moisturizing or soaking your hands and feet in cold water usually helps. But with cancer-related problems, these remedies don't work. You may feel temporary relief, but it doesn't solve the underlying cause. Many people mistake hand and foot itching for dry skin, diabetes, or poor circulation. They brush it off, thinking it's just old age. But if the itching is isolated to your fingertips or soles, you should be wary of abnormal nerve signals or systemic diseases. If you're over 60 and have experienced this type of itching for more than 3 weeks, you need to undergo a full medical checkup. Have you recently felt strange sensations or persistent itching in your hands or feet? Self-diagnosis. 5 simple steps. Now, let me share 5 self-diagnosis steps that you can do on your own. By simply remembering these 5, you can detect a serious issue early, sometimes early enough to save your life. 1. The 3-week rule. If the itch lasts more than 3 weeks, it's no longer just a simple skin problem. Common skin conditions or allergic reactions usually improve within 1 to 2 weeks. Mark it on a calendar and track the time. If it exceeds 3 weeks, go to the hospital. Second, lotion response test. Apply a moisturizing lotion or anti-itch cream 2 to 3 times a day for 1 week. If it's a surface-level skin problem, this should bring relief. But if the itch doesn't improve or gets worse, you should begin to suspect an internal cause. If external treatments aren't working, the issue is not with your skin. 3. Check for secondary symptoms. Itching rarely appears on its own. If you've lost 3 to 5 kilograms in a month, feel constantly tired, or have a persistent low-grade fever, you need to get tested for potential internal issues. If any of these symptoms occur alongside the itching, do not delay medical evaluation. 4. Analyze the itch pattern. Track when the itch gets worse. Cancer-related itching tends to be worse at night and better during the day. Also notice if the itch keeps returning to the exact same spot. If it doesn't move around and keeps flaring up in one fixed area, that's a red flag. Fifth family history review. If your parents or siblings have had cancer, your risk of developing cancer increases by 2 to 3 times. Be especially careful if it's the same type of cancer. Don't ignore subtle signs. Get screened more frequently if there's a family history. Please go through each of these 5 steps one by one. Summary and final advice. Thank you for listening to this long but important message. Let's review the 6 critical areas where cancer-related itching can appear. If your legs itch, especially at night, and creams don't help, it may be a sign of lymphoma. If the middle of your back itches and you have trouble digesting fatty foods, you should be checked for pancreatic cancer. If your scalp or behind the ears itches and shampoo changes don't help, it could be an early sign of leukemia. Ask for a blood test. If the chest area is itchy or irritated, this could point to inflammatory breast cancer. And men are not exempt. If there's persistent itching around the anus or genitals, it might be anal or vulvar cancer. Don't let embarrassment delay a diagnosis. If the palms and soles are itchy, it may be a sign of internal cancers, especially when accompanied by other symptoms. And remember the 5 self-check steps. The 3-week rule. Lotion response test. Secondary symptom check. Pattern recognition. Family history. If itching lasts more than 3 weeks, it's not just a skin issue. If lotions don't work, suspect something deeper. Fatigue, fever, and appetite loss are all tied to systemic illness. If the itch gets worse at night and always targets the same area, it could be cancer-related. And if you have a family history, even the smallest symptom deserves attention. Get checked frequently. Not every itch is cancer. But many cancers begin with a small signal. Don't dismiss your body's messages just because of age. Listen closely to what it's trying to tell you. I'm 88 years old and I'm still seeing patients because I know that tiny signs can save lives. After over 50 years of treating patients, this is the most important lesson I've learned. Most cancers can be treated if caught early. So here's something you can do right now. Tonight, before bed, examine your body. Where is it itchy? When does it worsen? How long has it been going on? Mark it on your calendar. Track the pattern carefully. If any of the symptoms I've mentioned match your own, don't be embarrassed. See a doctor. Be ready to describe exactly when the symptoms began, how they evolved, and any accompanying issues. Your health is your greatest asset. Not money, not success, not status, just health. Let this video be your first step toward living safely and consciously. In the next video, I'll share the hidden warning signs behind common age-related symptoms, like joint pain, indigestion, and headaches. There's so much we overlook. If you found today's message valuable, please consider sharing it. Let's spread this life-saving knowledge to those we care about. I truly hope you all stay healthy. And if you start today, what kind of life will you be living next year? Will it be a healthier, more vibrant life? Which part of your body will you check tonight?